Hi everyone, Dr. Carri Dominic, physical therapist, and today we're going to talk about long COVID and bladder leakage from chronic coughing. Super common thing I've seen in this pandemic. So I'm a pelvic floor physical therapist. I work on muscles of the pelvis. I work on bladder, bowel, and pain issues of the pelvis. So so prior to COVID, I always saw a lot of patients that had bladder leakage, and a common cause of that is coughing, sneezing, things like that. We call that, in the technical term, stress incontinence, because it's like the physical stress on the pelvic floor muscles of the coughing or sneezing that cause bladder leakage. And so I've always treated that. But then the COVID pandemic came along, and one of the symptoms of a COVID infection is a cough in a lot of people. And for some people, that cough lingers. That's their long COVID symptom, is a chronic cough. And so for some of my people who are maybe more susceptible to this, they get bladder leakage because of the chronic coughing. So what can we do about it? There is help. There is help. That's like the one message I want you guys to hear, because I know sometimes long COVID can feel like there's no help, there's no cure. But these are some of the successful things I've seen. And so I treat it how I would treat anyone with a chronic cough and bladder leakage. So the number one best thing we can do, which is not something I can treat, but is to get rid of the cough. That's like the number one thing. But with long COVID, we can't always get rid of the cough. That's the hard part. And so pelvic floor physical therapy can help. And so I'm going to show you a model of my pelvis, not my pelvis, but a pelvis. And so here's your pelvic bones. Here's your pubic bone in the front. These are your sits bones. Here's your spine in the back. And so I'm going to show you the bottom. This is a female model. And so here's the vaginal opening. Here's the rectal opening. This red part is all pelvic floor muscles, okay? They surround the vaginal opening, or they connect to the penis in a male. They surround the rectal opening. So often it's females, people born with vaginas, that get bladder leakage with chronic coughing. And so obviously there's this big opening here, and that just makes them more susceptible. And so what we can do is strengthen the pelvic floor muscles. And so, yes, that means Kegels. And so for a lot of my patients, when we examine the pelvic floor muscles, I look at, are they doing a Kegel correctly? And how strong are their Kegels? So there's ways we can measure that. There's something called a biofeedback machine, which has sensors that attach to these muscles. And then on a machine, it shows us what the muscles are doing. But also I will feel, I will look. There's lots of ways to assess it. And so if we can get these muscles stronger every time we cough, then hopefully that can squeeze around the vaginal opening and the bladder and prevent leakage. The problem is, I think chronic coughing is harder to fix, to prevent leakage, than chronic sneezing, like if you have allergies. So I want you to do an experiment with me, or just pretend you can just watch what I do. But when I cough, and I want you to try this if you can, a cough is a lower sound, and if you can think about it, so I'm sitting in a chair, it's pressure down on the pelvic floor. And so when I cough, I can actually feel my pelvic floor kind of going like this. So try it again. Obviously I'm like very in tune with my pelvic floor because I work on this every day with people, but I can feel it going down. Versus a sneeze, achoo, achoo. It's a higher pitch sound. I naturally go forward, and I can't feel this one as much, but I don't feel that pushing down on my pelvic floor. It's more like the sneeze comes up and out. And so that's a major difference. So another way you can experiment with this is different tones of your voice. So like a higher pitched tone, la 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 la, everything pulls up, right? Like your voice is a higher register, your pelvic floor pulls up with that. Whereas like, grunting, groaning, go, lower tone sounds are kind of pushing down on the pelvic floor. And so that chronic coughing is always pushing down on the pelvic floor. So it's hard, it's a harder thing to overcome. You need more strength to overcome that versus sneezing. I just tell people to sneeze, and often that's the only cue they need, and then they stop peeing when they sneeze because they were just trying to like hold it in, and then that's pressure down. So that's a mechanical thing. So chronic coughing, again, if we can't get rid of the cough because it's long COVID, then, and I mean, ask your doctor for cough suppressant, cough medicine, cough drops. Those things can help. Kegels can help, so we're directly strengthening this. But then I also have my patients, they'll do other exercises to strengthen the muscles surrounding the pelvic floor. So this never works in isolation. So we strengthen the hip muscles on the side and the glutes. The inner thigh muscles will connect in here too. So it's not just Kegels. Everyone thinks like, I just got to do Kegels and I'll stop peeing. That is one part of it, but it's not the only thing. And then I also see a bunch of people online now, a bunch of pelvic floor therapists, like, we don't do Kegels. Yes, Kegels, but yes, and. It's not Kegels or other exercise, it's Kegels and other exercise. And there's some other strategies too. But anyway, my message to you is there is hope. There is hope. Often, sometimes it takes people like a little bit longer for this to go away, and hopefully their cough is subsiding over time too, as we're strengthening the muscles surrounding the pelvic floor muscles in the bladder. But there's hope. Seek out a pelvic floor physical therapist. I will link a blog I have of how to find someone near you. There is hope. Okay, take care of yourselves.